Hey, what's going on, guys? I wanted to record a quick video on deep neck flexor training. So we do this a lot in PT for different reasons. And if you're seeing somebody in PT, they might describe these exercises a little bit differently than I do. But I just wanted to kind of walk through a really simple progression that might, for a lot of patients, take 6 to 8 weeks to actually get to the point where you're doing all these exercises. That's not uncommon at all. But to work on that functional instability of the cervical spine. So we typically start training a muscle in neutral in terms of its length, like kind of halfway between its fully shortened and fully lengthened position that's where the muscle's at strongest, and it's typically easiest to find that mind muscle connection there. So with the neck, that's going to be with the head in neutral. What you want to do is actually help to set your neck into a chin tuck position, because the point is that these muscles aren't really firing very well. So for somebody, it's easy a lot of times for the PT to show a patient and be like, okay, just do a chin tuck. But if their neck muscles aren't working very well, they can't really do a chin tuck very well. So I like taking the patient and just having them use their own hand on their chin, and we're gently going to be retracting the head over the body into a chin tuck position without flexing the neck up. And you want to be doing it at an intensity level that does not activate your sternocleidomastoid. So you can do a couple things. So at first, I just have them gently set their neck back. And then it's good to have them be able to monitor these muscles a little bit, and they should be able to tell that those muscles are not engaged. So sometimes I'll have one hand on the sternocleidomastoid, they're nice and loose, one hand on the chin, set back and make sure that these didn't kick on, and then we're just going to hold that for 10 seconds. All right. So that progression, I typically start 10 seconds, 5 repetitions. I move to 10 seconds, 10 repetitions, and sometimes I'll go all the way up to 30 seconds of 5 repetitions. So eventually, as the reps get longer and longer and longer, I might back the reps down a little bit. 10 times 10 seconds is kind of my pivot point, and from that point, I'll either change positions or I will continue to up the hold times. But what we want to do next is actually start to load the contraction by lifting the head. You have to realize at this point, if we start to lift the head, we can't keep these totally quiet. But that's why we want to have at least a week where we're just working on the deep neck flexor, like setting and the activation of those with just our chin tucks. So if we're going to go to a chin tuck and lift, it's going to look like this. From this point, the patient should be able to monitor just these muscles and draw their own chin down. So watch this. I'm going to go into this chin tuck. Just to the point, and these are still off, but I'm fully tucked right now. Then I'm going to try to maintain that as I lift. And we would hold this for 10 seconds. Nice and slow back down. The thing I like about using a pillow or using a bed, you don't even have to lift the head, right? Like, think if there was a scale underneath my head. Initially, I might just be decompressing about 1 pound. So if my head weighs 8 pounds or something like that, the scale might read 7. And then, every few days, you might be able to take another pound off of that scale in your mind. But using a pillow, like you saw, I didn't even fully lift my head from the pillow. I just kind of decompressed the pillow a little bit, and the pillow kind of chases you up. But that's totally fine. You don't want to jump from 0 to 60, right? And so the same thing, we want to slowly start decompressing more and more, allowing more and more of our weight to be supported just by these muscles until we can hold the whole head for 10 repetitions of 10 seconds. Same thing. Here, I'm either going to up the hold times or I'm going to change positions. I want to talk about changing positions a little bit. So all of that was still done in neutral. If we are wanting to move positions, I want you to start in flexion first for the most part. So I'm going to take a pillow and puff it up like this so that my neck is now resting in more flexion. So from here, the muscles are in a much shortened position, or much more shortened position. It's a little harder for you to contract them and use these holds. But what we're gonna do, same thing from here. I'm gonna have you use your hand, set your chin down into a chin tuck, and then decompress the pillow. And this is called an in-range contraction because we are in range as far as the flexion position. And then come back down. Same thing, you saw I didn't fully decompress the pillow. Initially, we're probably not going to be doing that. But we can work on this same thing 10 times for 10 seconds in this flexed position. If I want to move to an out of range contraction or a fully lengthened contraction, maybe not fully, but at least more, I put this pillow under my upper back, and now my head hangs down over it. So this is more of an extended position. This is the most advanced position, guys. Be careful with this one. So you're starting, the neck flexors are elongated. I'm going to go into this chin tuck, and from here, gentle lift and hold. Same thing. We're going to start with the 10-second hold if we're able to. And if we can get 10 good reps of that, then you can either start to increase your hold times or change your positions. But I like to start progressing these pretty slowly because they can often flare up the headache symptoms, the neck pain symptoms, if we're trying to make too big of a jump too quick in terms of intensity. If you make too big of a jump, go back to the prior level for a little while, or even 2 levels back until you've kind of calmed the symptoms back down, and then try to progress up a little slower the next time around. But that's a lot of times how we'll kind of progress or at least facilitate that deep neck flexor training and therapy. So if you have any questions on this, please feel free to message us, but I hope this video was helpful. Thanks for watching.